This podcast is for informational and educational purposes only. It is not medical advice, and it should not be used as a substitute for consultation with a qualified healthcare professional. Always speak with your physician or licensed provider before starting or changing any health, wellness, or supplement regimen. Let's dive into the fascinating world of cerebroprotides, a class of peptides that has captured the interest of researchers for their potential effects on brain health, cognitive performance, and neuroprotection. When we talk about cerebroprotides, we are referring to a group of biologically active short peptides that are derived from brain tissue and designed to influence processes such as neuronal survival, memory formation, and regeneration. These compounds have been studied for decades in Eastern Europe, Russia, and parts of Asia, but are only gradually becoming known in other regions of the world. Imagine how remarkable it is to think about small fragments of proteins, only a few amino acids long, being able to cross biological barriers and interact with the nervous system in ways that might influence memory, learning, and even resilience against injury. Unlike larger proteins or complex drugs, peptides like cerebroprotides have the ability to act more selectively, potentially triggering cascades that support natural processes in the brain. Researchers have explored them in contexts ranging from neurodegenerative disorders like Alzheimer's and Parkinson's to recovery after traumatic brain injury or stroke, and even for age-related cognitive decline. What makes cerebroprotides stand out is their proposed mechanism of action. They are believed to bind to receptors on neurons and glial cells, influencing the expression of genes tied to growth, repair, and neuroplasticity. This means they may help promote the survival of neurons, stimulate the growth of new synaptic connections, and reduce the damage caused by oxidative stress or inflammation. Studies suggest they may help regulate levels of neurotransmitters like acetylcholine and dopamine, which are central to memory, attention, and mood. Now, let's talk history. Research on cerebroprotides began in the mid to late 20th century, especially in Russia, where scientists were focused on improving cognitive resilience in demanding environments. Early experiments involved isolating peptides from animal brain tissue and testing their effects on learning and memory in animal models. Positive results encouraged clinical use in humans, often in neurological rehabilitation settings. Over the years, several branded formulations emerged, some of which became standard in Russian and Eastern European clinics. One of the fascinating aspects is how cerebroprotides are usually administered. Many reports describe injectable formulations, sometimes used in cycles of a few weeks, designed to stimulate neuroregeneration during critical recovery periods. Patients recovering from a stroke, for instance, were sometimes given cerebroprotides to help accelerate restoration of lost functions. The idea is that by supporting plasticity, the brain may be more capable of reorganizing and finding new pathways for movement, speech, or memory. Let's consider the science in more depth. Experimental studies indicate that cerebroprotides may enhance the expression of neurotrophic factors such as brain-derived neurotrophic factor, often abbreviated BDNF. These molecules are like fertilizers for the brain, encouraging neurons to sprout new connections and protecting them from damage. Enhanced BDNF levels are associated with better learning and memory performance, as well as improved mood regulation. If cerebroprotides can increase BDNF, they may provide a foundation for resilience against stress, aging, and disease. In addition, There is evidence that cerebroprotides may help reduce excitotoxicity, a process in which overstimulation by glutamate damages or kills neurons. By modulating receptors and supporting cellular energy balance, they could help protect delicate neural circuits during periods of stress. This neuroprotective role has made them a subject of interest for both acute injury and chronic diseases. Let's think about Alzheimer's disease. One of the hallmarks of Alzheimer's is progressive synaptic loss and neuronal death, leading to memory decline and confusion. In animal studies, cerebroprotides have been shown to improve memory tasks and reduce markers of neuronal degeneration. Clinical research, although more limited, suggests potential improvements in cognitive performance in patients with dementia. While these effects are not cures, they may represent an additional supportive tool. Another intriguing area of study is mood regulation. Depression and anxiety disorders have been linked to decreased neuroplasticity, reduced BDNF, and dysregulation of neurotransmitters. Some preliminary research suggests cerebroprotides might help restore balance, lifting mood and enhancing resilience. This is still a developing field, but it highlights the broad potential of these peptides. What about safety? Peptides in general tend to be well tolerated because they are broken down into natural amino acids by the body. Side effects are usually mild and may include injection site reactions or short-term discomfort. However, because cerebroprotides are derived from animal tissues, questions have been raised about consistency and sourcing. Modern formulations often use highly purified methods to ensure safety, but this is an area where regulation and oversight vary widely between countries. In terms of accessibility, cerebroprotides are not widely available in many Western nations. Their use remains more common in Russia and some parts of Europe. In the United States and other regions, they may not be approved as medications and could only be accessed through research settings or international sourcing. This regulatory gap is part of why you don't hear as much about them in mainstream medicine, despite decades of investigation. Now, let's shift to a practical perspective. Imagine an older adult experiencing mild memory decline. Traditional approaches might include lifestyle interventions, such as exercise, diet, and cognitive training, along with medications that address neurotransmitters. Adding cerebroprotides into the mix, if available, could theoretically enhance neuroplasticity and accelerate improvements. Or think about a young athlete recovering from a concussion. Supporting brain repair with targeted peptides might offer another layer of recovery support. These scenarios are still largely theoretical outside of certain clinics, but they give us a sense of what the future might look like if research continues. As always, there are caveats. Much of the research on cerebroprotides comes from non-Western countries, and the clinical trial data does not always meet the rigorous standards expected by regulators like the FDA. Sample sizes are often small, study designs may be less robust, and translation into English language literature is limited. That means while the results are promising, we need more large-scale, high-quality research to truly understand the scope of their benefits and limitations. Despite these challenges, cerebroprotides remain a compelling example of how peptides can be harnessed for health. They highlight the importance of thinking beyond traditional pharmaceuticals and considering the body's natural signaling molecules as therapeutic tools. With advances in biotechnology, we may see more standardized synthetic versions of these peptides, designed for safety, precision, and reproducibility. Looking forward, one of the most exciting areas will be the combination of cerebroprotides with other modern approaches. For instance, pairing them with stem cell therapy, neurorehabilitation techniques, or advanced cognitive training might yield synergistic effects. Imagine a protocol that not only supports neuronal growth through peptides, but also guides that growth through targeted brain stimulation or virtual reality-based rehabilitation. This is the type of integrative approach that could transform brain health in the future. Rather than relying on a single drug to fix complex conditions, we could support the brain from multiple angles: biochemical, structural, and experiential. Cerebroprotides may be just one piece of this larger puzzle, but they represent a significant step toward using biologically inspired molecules to influence health in profound ways. To sum up, cerebroprotides are a group of peptides derived from brain tissue, investigated for their potential roles in memory, learning, neuroprotection, and recovery from injury. They may enhance neuroplasticity, promote growth factors, and protect against damage. Research is ongoing, with promising but not yet definitive results. While not widely accessible in every country, they offer a glimpse of how peptide-based therapies could reshape the landscape of neurological care. This podcast has been created for informational and educational purposes only. It is not intended as medical advice, diagnosis, or treatment. Always consult a licensed healthcare professional before making health-related decisions. Thanks for listening, keep learning, and stay curious.